what I'd like to pick up is that last point, which I want to ask perhaps Leslie and Joe, to what extent you think group work and a youth work approach to helping young people with a psychological problem or a mental health problem, to what extent is that an area that we ought to develop further?
I'm quite a fan of group. I'm a psychologist, so we do quite a lot of things in groups, but sometimes people need to be helped to reach the point where they're able to access groups. So actually I think you need probably a mix of different approaches, and for some people the idea of a group is absolutely frightening, and I think we need different courses for different horses, and maybe we need different courses for different phases and for different needs. I do social confidence groups. There's no way I could achieve outcomes in terms of improving social anxiety or getting people to be more confident without running it in a group. But it's ironic, because to do social confidence groups, it's the reason why they're there is because they struggle in social situations meeting people. So you have to do perhaps some pre-work to get them to a point where they will come to a group. Once you've got them in a group, you can then do a lot of work with them and really build their confidence. And we have kids at the end of 12 weeks doing vox pops in the street, interviewing people, doing market research, and what's interesting, we've taken staff along, and it's the staff who say, I can't do this, I can't cope with the rejection, and it's the young people saying, oh, come on, just, sod it, just ignore them and go to the next one. And those are kids who've grown up with social confidence and anxiety difficulties. So some things really lend themselves to groups, but you may have to do some work alongside that. And some things, like Charlotte said, in terms of, say, individual counselling, might, again, be better done in a private and individual way. And I think we have a lot to learn. Some things are very familiar to certain agencies who have the skills and expertise in terms of working with young people and doing, youth-based activities. And what I've learned in any partnership is that I've gained from those partnerships in terms of learning about different ways to do things. And I've also learned from young people themselves, giving feedback and influencing what you do. And certainly that's led to the growth of You Think in the way that it has, because they can tell you what works, what doesn't work. I've had to learn from an adult service about giving things up to young people, because I predominantly work with adults across the whole age range. And, both in terms of terminology, the amount of activity, using humour, making things fun, all those things are all important. Thanks.
Just to add, really, I was just thinking about working in CAMHS and home treatment. I'm a great fan of group work, but there's kind of group work right from psychotherapy groups, right, obviously through to the activities that we've been hearing about today. I suppose one of the things that we found essential when we moved into home treatment and home support was making sure those young people weren't isolated and bringing them together at some time in the week. And I suppose there's anything positive about Tier 4, then it is the fact that at least young people have some sort of peer group. But unlike what you've got, they leave it behind when they're discharged. So, yeah, very, very keen on it. And I particularly, I've written it down all over my book about peer support. I'm really thinking about the strength of that.
I'm from Adult Commissioning in Warwickshire, and I've had a very interesting day learning all about the sort of children-focused issues. I've got two questions, really. Firstly is around, in Warwickshire, we're using the recovery model, the STAR recovery model, as a way of trying to standardise and move people on and out of services. And if we were doing transition work, it would be very useful that children were sort of thinking along the same lines. I've not worked in children's services, so I don't know, is that something that is already going on, or is it a possibility? And the second thing I was interested in was that that you've done all this work with big lottery funding. I don't know whether it's the first year of the 3-year project, but have you had any thoughts about kind of sustaining, how would you embed and sustain and commission ongoing work there?
Well, I can answer that. We've used the Recovery Star for You Think. and we've adapted it because obviously certain domains on the star are about employment and those things. So we have used education and training. But other than that, most of the points on the star are applicable. And what we have seen, because we've been using the outcomes star across all the different Rethink services, because obviously it's more focused to adult, but what we see is consistency in the Rethink YouThink scores and Rethink other service scores. So it clearly is picking up changes that are relevant, and the data is showing clear improvements from the YouThink programme on most of the domains, apart from life skills, and that may just be because of the expectations of what a young person is meant to do in terms of what's realistic for them. So yes, I think you can use Recovery Star. I actually think it's a very good measure, and the young people who've been through YouThink have actually really enjoyed using Recovery Star and didn't like Young People's Core, which was the validated outcomes tool for young people. They found that much more difficult to complete. And I think that's also something about the way when you use the stars, they're visual. So you can actually see where things move. Because for those of you who don't know, Recovery Star, you do a before measure and then you do an after, and you get this star point thing, and you can see where things have dipped or gone up. And it's actually a really nice way of monitoring progress.
I suppose say quickly that it seems, I mean, this is fantastic, the work that Cathy and others are doing. And to me, it needs to be everywhere. I'm beginning to become a fan of recommissioning, really, and looking at, well, where is the money now, and what is it that we truly need? But also, there are youth services in every city. And I spent years trying to get a youth worker who would come and work in CAMHS for a year, and we would do some work back with the youth service, and I didn't get anywhere. So, I mean, there are a lot of people with skills around. It's about using the resources that are there and having a clear design and a clear understanding of what we really need and what really makes a difference. But I suppose we haven't got time to do huge gold standard kind of research projects, but we have to. Listen to those young people and see the difference. We need a lot of what we've got already, but we need something else added in, and that is just there permanently, not continually as you're lucky if you get it, and an added extra. So that's certainly what I will keep going on arguing for. No, I'd like to lose the term CAMHS. Some people will be quite cross with me. I think the term CAMHS has just become meaningless. You get people talk about CAMHS, if you're talking about comprehensive CAMHS, you're talking about specialist CAMHS, and it just leads to total confusion. So I would prefer emotional wellbeing and mental health services than CAMHS. I don't know what we do about the mental health. Who would be upset if we just called all those services emotional wellbeing services? And would it be stigmatised in a different way? I mean, I'd really like to know what people think, because I think we've got to do a piece of work asking. We can ask young people, we can ask some of the professionals. I think some of the services work better where they're called a name almost, but that's not to pretend that they're not what they're about. But I went to a service the other day called the Hope Service, and the young people had called it that. And, then you can explain what the Hope Service is. It is about managing emotional well-being, but it's also about sometimes managing mental health difficulties, because sometimes it does get more than just emotional well-being. I don't know. What do people think? Should we just lose the word mental?
When I've talked to children and young people, actually one of the things that they fed back to me was that it didn't matter about the name. The thing that was important was that they knew what they were going to. And I think what Charlotte said about being referred and not knowing that she'd been referred, but why you were going there, and actually sitting down and having that conversation and talking about what the needs are and what you're going to do together is much more important than the title, was what I took from talking to young people.